Have you been told to try a Sitz bath and wondered what it actually does, when you should use it, and whether it really makes a difference? A lot of people hear about Sitz baths when they're dealing with hemorrhoids, anal fissures, pain after passing stool, soreness after childbirth, irritation around the anal area, or discomfort during recovery from certain procedures. But even after hearing the advice, most people are left with a long list of questions. What exactly is a Sitz bath? Why is it recommended so often? How long should you do it? How many times a day is enough? Should you use only warm water or add something to it? Can it actually help healing, or is it mainly for temporary relief? And are there situations where it is not enough and you should see a doctor? In this video, we're going to go through all of that in a clear and practical way, so you know exactly how to use a Sitz bath safely, when it may help, what mistakes to avoid, and what results you can realistically expect. Let's begin with the simplest question. What is a Sitz bath? A Sitz bath is a shallow soak in warm water for the lower pelvic and anal area. It is designed to bathe the buttocks, anus, perineum, and sometimes the genital area without needing a full bath. You can do it in a bathtub with a small amount of warm water, or with a plastic Sitz bath basin that fits over the toilet seat. Either option can work. The purpose is not to scrub the area or to treat the whole body. The goal is to soothe an area that feels irritated, swollen, painful, or sensitive, and in some cases to help keep it clean in a gentle way. Now, one reason this topic confuses people is that they hear it recommended in very different situations. Someone with hemorrhoids may be told to use it. Someone with a fissure may hear the same advice. A woman after vaginal delivery may also be told to do it, and a person recovering from anorectal surgery may get similar instructions. So naturally people ask, how can one simple thing be suggested for all of these different problems? The answer is that a Sitz bath is not aimed at a single disease. It is a comfort and supportive care measure. It may help reduce irritation, ease discomfort, soothe burning, and make the area feel more relaxed and easier to clean. That is why it comes up in different conditions affecting the same region. One of the most important things to understand is this. A Sitz bath can be useful, but it should not be treated like a magical cure. It may help with symptoms, it may improve comfort, it may make recovery easier, but it does not automatically remove hemorrhoids, permanently close a fissure, or replace a full treatment plan when the underlying problem needs medical care. This balanced understanding is really important. Some people ignore Sitz baths because they think something so simple cannot matter. Others rely on them too much and expect them to solve everything. The truth is usually somewhere in the middle. It can be very helpful, but usually as one part of a bigger approach. So when should you actually take a Sitz bath? Most often, it is used when the area feels sore, inflamed, irritated, itchy, swollen, or painful. Many people find it especially helpful after a bowel movement, because that is often the moment when symptoms flare the most, especially with fissures or hemorrhoids. Others may prefer doing it in the evening because it helps settle the area before sleep. In postpartum recovery or after a procedure, the timing should ideally follow the advice given by the doctor or care team. In general, you use it when symptoms are active or when it has been recommended as part of recovery. Then comes another very common question. How often should you do it? A typical routine is 2 or 3 times per day, and for some people, especially when bowel movements are painful, after passing stool may be one of the most useful times. But there is no need to overdo it. Doing it again and again all day long is not usually necessary. With a Sitz bath, gentle consistency tends to matter more than repetition. And how long should each Sitz bath last? Usually around 10 to 20 minutes is enough. It does not need to be much longer than that. This is a short soak, not a long treatment session. People sometimes assume that if 15 minutes helps, then 45 minutes must be even better, but that is not really how it works. Sensitive tissue usually responds best to simple, moderate care. Now let's talk about why warm water helps at all. Warmth can calm irritated tissue. It can also help the muscles in that area relax. That is especially relevant in conditions like anal fissures, where pain can be tied to muscle tightness or spasm. In hemorrhoids, the benefit may be more about soothing the area and reducing the discomfort that comes after wiping, sitting, or passing stool. After childbirth, the benefit may be comfort and gentle cleansing. So while the exact reason may differ slightly depending on the situation, the general effect is that warm water can make a painful or irritated area feel less tense and more manageable. Let's take hemorrhoids first, because this is one of the biggest reasons people search for sitz baths. Hemorrhoids can cause burning, itching, pressure, swelling, tenderness, and sometimes bleeding. When the tissue is irritated, a warm sitz bath can feel very soothing, especially after a bowel movement. It may reduce discomfort and help the area feel calmer, but it is very important to keep expectations realistic. A sitz bath does not remove the causes that often keep hemorrhoids going, such as constipation, hard stools, straining, poor bowel habits, not enough fiber, or not enough water. So while it can help symptoms, real improvement often also depends on changing the factors that keep irritating the area. Now consider anal fissures. A fissure can cause some of the sharpest pain people experience during or after a bowel movement. Many describe it as tearing, cutting, or intense burning. In that situation, a sitz bath may bring meaningful relief because it can soothe the area and help the muscles relax afterward. That can make a painful cycle more manageable. Still, the sitz bath is not the whole answer here either. Softer stool, hydration, avoiding strain, and in some cases medical treatment are often central parts of getting better. So if someone asks whether a sitz bath can help a fissure, the answer is yes. It may help a lot with comfort, but it should not always be seen as enough by itself. Now let's move to postpartum use. After vaginal delivery, especially if there has been tearing, stitches, swelling, or an episiotomy, the perineal area can be very tender. In that setting, warm water may provide comfort and a very gentle way to care for the area. For many people, this kind of simple relief can make daily recovery feel more manageable. But postpartum recovery can vary from person to person, so it is best to follow the instructions given by the doctor, nurse, or midwife. The general principles stay the same: clean setup, warm water, short soaking time, and gentle care afterward. Sitz baths may also be advised after certain surgeries or anorectal procedures. If that is your situation, personalized instructions matter even more. If a surgeon has given you a specific plan, follow that plan rather than combining it with random advice online. The details of recovery may vary depending on what procedure was done and how healing is progressing. So how do you actually do a sitz bath the right way? If you are using a bathtub, add a few inches of warm water, just enough to soak the affected area comfortably while sitting. If you are using a toilet seat basin, place it securely, fill it with warm water, and sit carefully. The water should feel comfortably warm, not hot. Stay there for about 10 to 20 minutes. When you finish, get up slowly, especially if you tend to feel lightheaded. Then dry the area gently with a clean, soft towel by patting it, not rubbing it. That last part is worth repeating because it matters. Gentle drying is better than friction. If the area is already inflamed, torn, swollen, or healing, aggressive rubbing may worsen the irritation instead of helping. A lot of people also ask whether the water should be warm or hot. The answer is definitely warm, not cold and not very hot. Hot water can irritate sensitive tissue and make an already uncomfortable area feel worse. The goal is soothing warmth, not intense heat. Another question that comes up all the time is whether you should add something to the water. People ask about salt, Epsom salt, antiseptics, soap, baking soda, oils, or herbal remedies. In general, plain warm water is often the safest and simplest choice. Many people assume that adding something extra will make the bath stronger or more healing, but sometimes it only increases irritation. Unless a healthcare professional specifically told you to use a certain additive, keeping it simple is usually the best approach. Can a sitz bath ever make things worse? Yes, if it is done incorrectly. Water that is too hot can irritate the skin. A basin or tub that is not cleaned properly may create hygiene issues. Harsh rubbing afterward can aggravate symptoms. Random products added to the water may lead to more burning or irritation. And perhaps most importantly, A sitz bath can delay proper care if someone keeps relying on it while symptoms are getting worse and the real problem is not being addressed. So what should you do after a sitz bath? Usually the best next step is to gently dry the area, put on clean and comfortable clothing, and avoid anything tight or rough if possible. If you have been prescribed a cream or ointment, follow the instructions given for when to apply it. In many cases, people apply topical treatment after the area has been gently dried, but that depends on what the treatment is and what condition it is for. Do you need to wash with soap afterward? Usually not. In fact, overwashing can sometimes create more irritation. The Sitz bath itself may already provide the gentle cleansing that is needed. So after the soak, the focus is generally on being gentle, not on doing more. People also want to know how many days they should keep doing sitz baths. There is no single answer that fits everyone. If symptoms are short-lived, you may only need them for a few days. In postpartum recovery, it may be useful during part of the healing period. After surgery, you may be given a specific schedule. So instead of asking only how many days, it is often better to ask, am I improving, and is this still serving a useful purpose? If the answer is yes, that is a good sign. If nothing is improving, the plan may need to change. Then there is the question of when to stop. Usually, sitz baths can be stopped when the symptoms that led you to use them have calmed down, or when your clinician tells you they are no longer needed. But if you find yourself depending on them over and over for the same recurring symptoms without real progress, that is a sign to step back and ask why the problem keeps returning. The sitz bath should not become a substitute for understanding the actual cause. What about pregnancy? In many cases, a warm sitz bath may be used as a comfort measure, especially if hemorrhoids are causing symptoms during pregnancy. But the same rule applies. Keep it simple, keep it warm rather than hot, and do not ignore anything unusual. If severe pain, significant bleeding, or other concerning symptoms are present, it is best to speak with a healthcare professional. And what about children? In some cases, a doctor may recommend a sitz bath for a child depending on the situation, but it is not something to improvise casually. Children are more sensitive, and the reason for the symptoms matters a lot. If a child is having pain or irritation in that area, getting proper medical advice is the right move. Now let's talk about the most common mistakes people make with sitz baths. Using water that is too hot is one of the biggest. Another is adding ingredients just because they were mentioned online. Not cleaning the basin or tub properly is another. Rubbing the area dry instead of patting it gently is also very common. And then there is the bigger mistake of assuming that temporary relief means the problem has been solved. Relief is helpful, but it is not always the same thing as recovery. So what else should you do along with a sitz bath? This is actually one of the most important questions in the whole topic. If the problem is related to hemorrhoids or fissures, then bowel habits matter a lot. Constipation, hard stools, low fiber intake, poor hydration, and repeated straining can keep the cycle going. So often, the best results come when sitz baths are combined with softer stools, better hydration, improved fiber intake, gentler cleaning, and any prescribed treatment that may be needed. And what should you realistically expect? A sitz bath may reduce burning, soreness, itching, tightness, and irritation. It may make bowel movements easier to recover from. It may help you feel more comfortable during healing. It may support cleanliness without harsh wiping, but it may not remove the condition itself. It may not cure chronic hemorrhoids or fully heal a fissure on its own. So the right expectation is relief and support, not guaranteed cure. That brings us to an important final point. When is a sitz bath not enough? If you have heavy bleeding, severe pain, fever, unusual discharge, worsening swelling, spreading redness, or symptoms that keep returning or are not improving, then home care alone is not enough. The same applies if you assume you have hemorrhoids but have never been properly checked, especially if bleeding is involved. Not every anal or rectal problem is simple hemorrhoids, and not every postpartum symptom is routine healing. Supportive care is useful, but it should not delay proper evaluation when warning signs are present. And one more thing that matters a lot. There is no reason to feel embarrassed about these symptoms. Pain in this area, hemorrhoids, fissures, bowel-related discomfort, and postpartum soreness are medical issues. They are common, and they deserve proper care. Too many people wait longer than they should because they feel uncomfortable talking about it. But getting the right advice sooner often makes everything easier. So let's bring it all together. A Sitz bath is a simple and practical way to soothe the anal and perineal area when it is irritated, painful, swollen, or healing. It is commonly used for hemorrhoids, anal fissures, postpartum soreness, and recovery after some procedures. It usually works best when the water is warm, the soak is short, the setup is clean, and the area is dried gently afterward. It can be very helpful for relief and comfort, but it works best as part of a broader care plan rather than as a replacement for proper diagnosis or treatment. So if you've been wondering when to take a Sitz bath, here is the simple takeaway. Use it when the area is sore, irritated, itchy, swollen, or painful, especially after bowel movements or during recovery when a clinician has recommended it. Keep the water warm, not hot. Keep the session short. Keep the setup clean. Dry gently. And if symptoms are severe, persistent, or getting worse, do not depend on a home remedy alone. And if there is one message to remember from this entire video, it is this: simple, gentle, and sensible care often works best. Warm water, clean equipment, gentle drying, realistic expectations, and medical advice when something does not feel right. That is the smartest way to use a Sitz bath. If this video helped you, subscribe to the channel, share it with someone who may find it useful, and leave a comment below with the health topic you'd like to see next.